Today, we're going to talk about ACL injury and return to sport, and specifically about why or should handheld dynamometry be used in return to sport testing, especially rate of force development. And so it's a topic that I think is well studied, and we have two guests here that are educators at a university that we'll introduce here in a minute that will talk through a lot of why, especially in ACL or knee injuries, why using a handheld dynamometer is so important for a return to sport decision. Introductions. Those of you who may know me, I've been the kind of the host for Active Body in these webinars over the last number of years. For those who don't, my name is Daniel Stewart. I'm a physical therapist based out of Salt Lake City, Utah. I help manage a practice here, and we treat patients of all different kinds. When I got out of school, I realized that handheld dynamometry was not subjective or was not objective enough for my patients to really understand why we were going through kind of the strengthening portion of rehab. And so I sought out Active Body, and we helped develop the what is the ActivForce 2 device, and the software in order to give objective data not only to patients but to insurance, and then also to use in the way that I prescribed home exercise programs and treatment programs to make sure that I was hitting exactly what the joint needed for both range of motion and strength. So it's been quite a journey over the number of years, and excited to walk through how it's used specifically in these cases. We'll also introduce Kevin. I'll let him introduce himself, but Kevin and Christy have been really close partners to Active Body for a number of years, and we're excited to continue the relationship with Belmont University and everything that they're doing there. So I'll turn the time over to Kevin to introduce himself, and then we'll move to Christy.
Good morning. My name's Kevin Robinson. I'm on faculty with Belmont University, as Daniel mentioned. I teach our biomechanics course. I'm also one of the instructors with our orthopedics courses. And over the years, I've had the opportunity to work with athletes of all levels, high school through professional. I've been working with Active Body since 2018, and I'm really excited to see how this area has really enabled me to be a better clinician, and to offer more things to the athletes as well as patients that I see. And I look forward to talking with you later this morning.
Thanks. Awesome. Thanks, Kevin.
Hello, everybody. I'm Christi Williams. As mentioned, I'm also faculty at Belmont University. I teach with Kevin. We've taught together for a number of years now, and in the kinesiology course that we teach, we have been introducing handheld dynamometry to our students for I don't know how many years, but probably at least 10 years already, where they are learning this in an entry-level program, because we have found so much benefit in working and using something that can be a bit more objective when it comes to strength testing in the clinic with our patients. So I'm an outpatient orthopedic PT, and one of my kind of areas of specialty is some return to sport testing. So the handheld dynamometer has certainly been a huge asset to doing that because it's just quick and easy and objective.
Awesome. Thanks, Christy. Okay, so to go over the agenda for today, we're going to start. We already started with our introductions. We're going to go over understanding what an ACL injury is, including some clinical presentations, mechanisms of injury, and some common causes and risk factors. We'll then go over common ways for performing return to sport screens, including functional testing and dynamic testing. And then we'll end with a handheld dynamometer assessment and a discussion on treatment and rehab strategies. And then at the end, we'll have about 10 minutes for a Q&A. For those who have been a part of our webinars in the past, we love questions. So if you have any questions or any thoughts that you'd like us to talk about live during the webinar, if you want to drop them in the comment section, then our team here at ActivForce will get those questions to us. If they align with kind of the flow of what we're talking about, we'll answer them live. If not, we'll save them until the Q&A portion. And then if we get an abundance of questions, of course, feel free to always reach out post webinar via our helpline, and I'll make sure that Kevin and Christy get those questions if there's something specific that we need them to answer. The last thing I'll say is that our webinars are very, very driven by feedback from our listeners. So if you have any feedback after the webinar, there's going to be a survey that's sent out. We do look at that on a religious basis. So if you could fill out what you thought about the webinar, things that we could make it better, and maybe even things we did well, that would go a long way to helping us make sure that we're providing value in these webinars. All right, so we're going to get started understanding what an ACL injury is. Now, many of you most likely have heard of ACL injury. This is most likely going to be a refresher for what you already know. But an ACL injury is a tear or a strain of the ACL ligament or the anterior cruciate ligament. This ligament prevents a forward moving of the tibia on the femur, and oftentimes provides stability not only in rotation but also in extension. Injury to this ACL often results in instability and happens most likely in cutting or pivoting movements. I was reading a little bit on some of the statistics here, and there's over around 500,000 ACL injuries, reported ACL injuries a year. And there's a higher likelihood, at least in the studies that I looked at, in females and their risk factor for ACL injuries. I think it's almost double actually the incident rate as males in some of the studies I was reading. So very, very interesting injury, and we'll go over what the clinical presentation looks like. From a clinical presentation, oftentimes people report a pop. So that's a plant and twist. They hear a pop. There's almost immediate swelling and then a giving away or instability in the knee. And then as you're moving it through the range of motion, there's limited range and pain, as well as difficulty bearing weight. And so when you see a patient comes in, usually, or if usually it's at the time of injury, whether they're playing a sport, and we'll watch one here in a minute. You'll obviously see somebody come in. They're oftentimes non-contact injuries. I think I read 70% of these injuries are non-contact. Oh, here we go. Non-contact, sudden deceleration, pivoting or cutting. But it can happen from a contact where they're hit at a lateral knee, causing valgus or rotational stress. And it occurs in sports such as football, basketball, soccer, really any sport that involves, as we see here, jumping, pivoting, or rapid changes in direction. So just to highlight kind of a less intense ACL injury, I wanted to play this video. As you can see there, immediately grabs the knee, feels the pop, plant and twists. This is a super common result of an ACL injury. Kevin or Christy, I didn't know if you wanted to add anything to that.
Uh, no, just what you were saying as far as the injury rate. Yes, females will, depending on what study you're looking at, or three as much as 5 times more likely to tear their ACL, unless you're looking at a sport that involves a cleat. And actually, the injury rate for females is closer to 8 times that of
Really?
males. Yes.
Wow. That's eight times. And what would you say? I think I have some thought processes, but I think we're going to go over maybe a little bit of predisposition factors, but I'm sure there's something that has to do with like the Q angle and maybe some hormonal differences between men and women that kind of increase that risk. Is there anything in particular you wanted to add there?